Yeah, thank you. Thank you. I had a little bit of a challenge in joining. I think I had a problem with my link, but I'm happy to be here. I just wanted to confirm, I was not very clear on what time has been allocated for this particular presentation. So I just wanted to confirm how many minutes do I have?
Sir, I can give you 10 minutes, but I will keep the welcome and housekeeping shorter so you can have a few additional with that as well.
Okay, that sounds good.
Okay, great.
Thank you all for joining. Thank you very much, Dr. Sultani, for being here with us today. I think when we are all ready, we can just start. Everyone is now joining. So, Sabah, when you're ready, please, we can let in others. Thank you. Madia, all to you. Thank you.
No pressure, Omar. Thank you, everyone, for joining us today. We'll start in a few minutes as we think through, as we allow people to enter our room and our space. But I'll keep speaking in the meantime because my name is Madiha Latif. As way of introduction, I am with Pathfinder International with the Strategic Engagement and Innovation team, and currently serve as the Vice President uh, um, for Pathfinder International. And I'm really excited for the opportunity to moderate such a high level panel with some very key insights and into how care investments can look at how can we look at care investments as an economic imperative that moves towards investing in solution centered approaches supported by governments, by intergenerational dialogue and conceptual design. So we have a very exciting panel for you today, and we look forward to also giving some time to our participants at the end to ask questions or share their reflections. So we'll start in just a few moments. I see some people still entering the chat, and I'm going to take this opportunity to quickly acknowledge Women in Global Health, who are our partners in all things health, but particularly for this virtual webinar that you have in front of you today. The theme for this webinar will look through how health and care economy is not just a public health imperative, but rather a proven strategy for social development and economic development as well. These investments, as you'll see, have shown to improve health outcomes, reduce inequality, and build in more equity and more resilience within the societies that they find themselves a part of. So, as we explore how centering care and health work, especially in women work, is imperative for economic development, we also want to introduce to you Pathfinder's social innovation platform, which is Women and Co. Women and Co is designed as an engine for innovation to co-create solutions with women and girls in the countries that we work with, not just as active beneficiaries, not just as beneficiaries, but participating as active leaders in solution development. And we invite those that would be interested in partnering with us as we look towards creating the ecosystem and convening the platform in the different countries that we work in to co-create solutions for the future. So without taking more of your time, I invite you to leave some notes in the chat if you can. Please feel free to add in questions in the chat. There will be some time for question and answers at the end of the session. And I look forward to hearing from you as participants in this to see to hear your reflections and also talk about some of the potential brewing ideas that you may have. And now I will invite Dr. Dr. Sultani Hadley, who is a prominent figure in Kenya's healthcare leadership, currently serving as the Deputy Director General for Health. He has 2 decades of experience as a consultant, clinical pharmacist, and has made significant contributions to public health management and clinical practice. He's played a pivotal role in establishing the Kenya National Public Health Institute, and this underscores his commitment to advancing healthcare infrastructure and policy in Kenya. So, Dr. Sultani, over to you, and thank you for your time.
Thank you very much, Madia. I am really happy to be here, today to actually share some thoughts on this very important topic. So, from here, it's afternoon, so I hope to all those who are listening from all corners of the world, good afternoon, and depending on where you are, good morning, good evening. It is indeed a great privilege for me to join this dialogue at this second World Summit for Social Development, which has been convened by Pathfinder International, and as we have had also in partnership with Women in Global Health. One of the things that really caught my eye as I was preparing for these remarks was the theme of this particular meeting. And when we talk about, the theme from care workers to entrepreneurs, this is such a powerful statement, given that it speaks to a profound truth. And that is the fact that women work in care is both the invisible backbone of society, and a very powerful lever for economic transformation. Because it is one of those, as we say, invisible, but very, very important contributors to economic transformation, as we will see shortly. We know that, all over the world, women represent about 70% of the health and care workforce. This is a very big proportion of our population. But then they remain concentrated in the low-paid, low status, or even unpaid roles, despite their essential contributions to health, education, and social well-being. Investing in care work is therefore not just a social imperative. It is a sound economic policy. Quality, fairly paid care jobs lift families out of poverty, and they strengthen economies and enhance national resilience. Because we know that when families stay healthy, when families are supported, then they participate much better in national building and economic growth. Now, when we look at Kenya, for example, as a country, in our realization of these important imperatives, we have begun to institutionalize this investment through our community health strategy. You will find that currently, as we speak in Kenya, we are deliberately implementing universal health coverage. And one of the things that we have appreciated is that primary health care is a cornerstone to achieving universal health coverage. We have transitioned over 100,000 community health workers, whom we have now called community health promoters, from voluntary to compensated professionals. So one community health promoter actually on average reaches about 500 people in the community to be able to provide essentially disease prevention and health promotion services. And this has become a pool of people in whom we are able to mainstream care work and to see how we can be able to anchor it. This reform anchors care work within the universal health coverage framework, recognizing it as a cornerstone of primary healthcare, disease prevention, and health promotion. We are also leveraging our whole of government and whole of society approach to sustain these reforms that I'm talking about, such that we are aligning the public sector, private sector, and also the community at large to strengthen the care economy. Because we have discovered that it is not possible for the health sector alone to be able to deliver on something as profound as universal health coverage. And so we have to reach out to all the other sectors within the government and even beyond in the private sector to be able to bring this to bear. So Kenya views care work not as charity, but as a strategic investment that yields high returns in health, productivity, and equity. We have actually been able to see that from anecdotal information, that for every 1 shilling we invest in disease prevention and health promotion, we are likely to save upwards of 9 shillings, that is our currency in Kenya, which would have gone into curative services, would have gone into rehabilitative services, as well as palliative care. And so that makes it possible for us to shrink the requirement for curative, rehabilitative, and palliative services to a much more affordable, cost. Now, beyond government action, we also celebrate the innovation from our partners. Pathfinders, Women and Co., which we have just been told about by Madiha, and other initiatives, for example, empower women entrepreneurs to distribute health and wellness products, turning care work into sustainable income and social impact. So that now care work becomes a platform through which people can empower themselves, especially our women, and they are able to derive much more from this and also to progress even as they move further, into the future. Now, ultimately, care work is essentially economic infrastructure. Most of the time we tend to look at care work as if it is some distant thing out there, very separated from economic issues. But then, when we look at it critically, we find that it is economic infrastructure, the foundation upon which human capital, inclusive growth, and sustainable development are built. Because whenever we miss this, then we find that we are having difficulties, especially in the global south, where we have not yet invested optimally in some of these critical public health building blocks. So care work really needs to come to the center of economic development, not just as something that is happening, but as a very important building block to economic development, especially in the global south. From invisible labor to visible leadership, let us invest in women, and especially in women-led care, as both a right and a strategy for more equitable, prosperous world. Because, women are about 50% of our population, and they are a big workforce that can contribute to economic development within, especially this part of the world. So thank you very much, ladies and gentlemen. I really wish you a pleasant discussion over the next hour, and I'll be looking forward to hearing a lot of the issues that will come out of the plenary on this very important topic. Thank you very much, and back to you, Madiha.
Thank you so much, Dr. Sultani, for what an inspirational message, if anything. I don't know if you can see all the reactions to what you've been sharing, but it resonated deeply with all of us. I especially loved your piece on from invisible labor to visible leadership. I feel like that's a tagline in the making. So thank you for that nugget. But what I really wanted to appreciate and underscore is how you've connected care both from a burden of care, unpaid labor, but also thinking about the labor pieces of it and how all of it is connected in order for us to really move the needle on primary healthcare service and service delivery for women and girls in the global south. And that brings me then to Miss Sonia, who joins us from the Southern Center for Inequality Studies. And Sonia, everything that you've just heard from Dr. Sultani really guiding us on how the imperative right now is to invest in care economy. So I wanted to maybe ask you to dig a little deeper into that. How do you see the care economy investments translating into social and economic resilience? So I invite you to share your work and your brilliance to everybody here. Thank you, Sonia, for having us, for being with us.
Thank you. Thank you so much. I hope you can hear me.
Yes, you're audible. Thank you.
I'm also. Thank you. Thank you very much. And it's a real pleasure to be a part of this panel. And thank you to the organizers for inviting me. And yeah, care is central to both economic resilience and sustainability. In the work that I'm doing currently at the Southern Center for Inequality Studies, we are thinking about the ways in which care is organized or changes in the organization of care because of climate change. And what we've seen is that investing in care, whether through childcare, elder care, healthcare, or social protection, it has clear economic benefits. It creates jobs. It supports women's participation in the labor market. But we also argue very strongly that care has a transformative potential that goes beyond kind of economic logics or economic resilience. If we truly want investments in care to be a catalyst for social and economic transformation, then we have to think about how it reshapes the way our economies and societies are organized, in the sense that we should be thinking about investing in care in ways that respond to important questions such as whose work is valued, and how care is and should be distributed and valued. And yeah, I was very struck by Dr. Saltani's inputs now, where he spoke about care as important economic infrastructure. And yes, we agree that that care is just as essential as other types of infrastructures like roads, or technology infrastructures, because it sustains the labor force, it builds human capabilities, and it enables communities to function and exist. And so when countries invest in care, the returns are tangible, and a wealth of studies have shown that investing in care and in the care economy creates more jobs, and it's a key driver of both growth and equality. However, a lot of the current policy language around gender and care and development has been shaped by what we know as feminist economists as smart economics. So this idea that investing in women and girls yields the highest returns for growth and development. And while this argument is powerful because it's helped make the case for greater attention to women's economic participation, many feminist economists and activists have also argued that this logic of smart economics also has its limits, in the sense that this framing tends to focus narrowly on women's individual empowerment. So things like access to credit, training, or employment. And this framing assumes that structural barriers such as discriminatory laws or unequal gender social norms will somehow adjust themselves. And in practice, this can place a heavy burden on women who are often depicted as kind of endlessly resourceful and endlessly resilient and endlessly altruistic. Women are expected to hold families and communities together in the face of shrinking public services or in the face of economic shocks or environmental shocks. And so the argument is that this narrative of investing in women only for economic benefits risks recasting women as a solution to crisis that they did not create. And so the risk is that we measure empowerment only in terms of economic output without challenging the structures that constrain women's equal participation in our economies. And so if we really want investing in care work to be transformative, it cannot be treated simply as a means to increase GDP or labor supply, or a means to increasing, more women entrepreneurs. Investing in care must be understood as a pathway to building transformative economies, which means in many ways shifting away from extractive short-term models of growth to systems that sustain and care for people, communities, and the planet. And so, what does this transformation look like? I'll give three kind of options. The first, very well-known options. So the first is about redistributing care. Care should not be the invisible burden carried primarily by women. Care work needs to be socialized. A transformative care agenda ensures that men and the state all share responsibility for the provision of care, so that it is not only something that is seen as women's work. And the state has an important role to play in building affordable public infrastructures that makes the provision of care easier to do. Second, transformation means recognizing care work, so valuing care and care work as skilled essential work, which requires decent pay, safe working conditions, and social protection for care workers, who are often among the most precarious and underpaid in the economy. And third, it's about representation, so ensuring that those who provide and depend on care have a voice in policy decisions. Care systems are that are participatory, that are inclusive, and are accountable are more likely to meet most people's real needs. And so to make it truly transformative, we also need economic policies and institutions that reflect these priorities. That means aligning macroeconomic and social policies like fiscal policy, taxation, labor regulation, and social protection, with the goal of building caring, inclusive economies. And so we must ask important questions like, are our budgets gender responsive? Are our public investments designed to reduce unpaid care burdens rather than increasing them? Are our institutions right for women, as Naila Kabir puts it, meaning, do these institutions dismantle gender bias and gender norms rather than reproduce it? And so, I think that this is an important point, because it's not only about new programs or funding streams. It's about reorienting our economies from viewing care as a cost to recognizing it as a productive investment. To close, investing in care does indeed make economic sense. We know it improves employment, and it improves economic resilience. But I think its most important impact lies in how it can transform our economies, and investments in care can help us move away from from extractive economies, to economies that value well-being and that value well-being, which is over profit, which I think is really important. So I'll close there. I'm looking forward to the conversation.
Thank you so much, Sonia, for that very insightful piece, because I think you highlighted one of the key challenges that we've had in the past and continue to see also even as we develop and build the narrative around care work and care economy and the investment within that. And two things that really struck out to me really was when you spoke about measurement of empowerment and how we are limiting the way we define what empowerment looks like, and then its contributions directly only connected to the economic or the macro level conversations. And again, a very important point that you brought up, which resonated strongly, was about how we need to move away from just the investments from the perspective of individual growth or individual agency or empowerment, but really thinking about it from a systems level, and how we need to connect all the systems and all the alignment across policies and frameworks which vary across the board in order to create an ecosystem that allows for women to thrive in whatever choice that they would make, but centers around their needs and their health. So I really wanted to appreciate that insight, Sonia. Thank you so much. And as you were talking, I'm gonna invite Tiffany, who's here and is the founder and executive director of the Dove Foundation for Global Change. The reason, Tiffany, I bring you now in is actually because as Sonia was talking about systems level investment alignments, but also the different needs of women across the board, I think it's really important to also highlight the needs to think about it from an intergenerational perspective. So as we think about strengthening women's leadership in shaping the future of care systems from an intergenerational action or an intergenerational perspective, we'd love to hear what your experiences have been and what your learnings have been, and how do you see this shaping out for the future? So to you, Tiffany, and thank you for joining us.
Thank you so much. And it's been such an interesting conversation so far. And I'm really happy that you've put it in this way, because when we talk about women's leadership and when we talk about the care economy, it's so important that we look at it from, an intergenerational lens and perspective. Because right now we're witnessing two quite large shifts in the care economy happening at once: an aging population hands-on care, as well as for paid work and for meaningful work that we haven't really seen before. So if we can bring these two things together at once, we could, have care become an intergenerational engine of employment and knowledge, and of knowledge transfer led by women, passed on to young women. But, that isn't what's happening right now at the moment. We do have to recognize that there is a bit of irony that women make up 70% of the care economy, but yeah, they still live themselves in 25% of time in poorer health than men. They're the backbone of the care economy, sustaining, the very system that's meant to deliver care for themselves. Yet, it's relied on almost exploiting women's unpaid labor. So yeah, looking at how women make up 70% of the care economy, and there's such a large shift from older people supporting the care economy to young women, who themselves are about 60% of carers who are unpaid. We do need to create some kind of systemic change, looking through an intergenerational lens. And that really is looking at policies of how we can get governments to actually support women who are in unpaid work, how programs like Women & Co could even come into this, and formalizing that transition from informal carers, unpaid work that young women are having to do, to registered micro entrepreneurs, and just ensuring that young women are actually recognized and visible in the care economy, having leadership positions, because yes, it's 70% of women, sustaining the care economy, but they're not actually in these leadership positions. So when we're making that transition, it's also important that we're adding young women to that mix as well.
Thank you, Tiffany. Would it be okay if I asked you just a slight follow on, just as we move to that? You mentioned about the older generation and the care burden on that and the investments in the care burden. But there's also, I think, an aspect that um, for cultures like my own, I'm from Karachi, Pakistan, and cultures like my own, there is a caregiving burden on women as well, right? Whether we think about it from the perspective of us caring for our parents, but also caring for our in-laws or elderly within the homes, and I'm wondering, as we think about the leadership aspects of that, like how can the system support women to really be out there and be leaders, but also be able to access affordable care for those that need a different form of attention or a different level of care, almost in order for things to go almost side by side and continued. Any insight on that would be wonderful.
I think, well, it starts really in two places. First off, looking at maybe a culture shift, recognizing that yes, women currently do have the care burden globally, especially in certain communities where it's almost expected for women to undertake unpaid care work from even really young ages, actually, that it's starting, and recognizing that that might not be okay and that maybe this work can be shared and that women's leadership and engaging in the economy or society in some form also must come at the same time. So if you have people who are having to partake in unpaid care or care at all, especially of relatives, of grandparents, of family members, saying how can we support them to still have a place in our society and in our economy and in our country. But really, that doesn't just come down to social changes and how communities feel. It comes down to government intervention and government policies and saying, how can we actually formalize these things? How can we recognize what these women, the contribution that they're giving to our country? How can we recognize that there does need to be a shift from either supporting these women and letting them stay in these positions, but recognizing that they now have to become part of our economic infrastructure and national economic policies when they're looking at, how do we start, supporting younger generations to get into work? It needs to be young women in care also. So really, it does come down to economic policy from governments recognizing these women, recognizing their place in society and the economy, and recognizing that they need to be supported a lot more.
Thank you, Tiffany. And as you were speaking, one of the things that came to me directly was also not just at the aspect of caregiving, but also what one of the important statistics you highlighted about how women spend less time as compared to our male counterparts accessing healthcare services, but also just generally taking care of ourselves, right? And I think that's an important conversation also to talk about the deprioritization of health that women sometimes are almost pushed in a corner to do, given limited resources, familial responsibilities, over prioritizing everything else and deprioritizing themselves. And I think that's where the whole new generation of self-care really comes about and continues to be something that younger women and our younger generations are pushing forward, not just within home, but also in the economic spaces as well, right? We are hearing about this whole not hearing, but actually seeing it unfold in action, the work-life balance, which is a key part of how people want to take care of themselves and invest time in things that they like beyond just generation of income. So I think with the perspective you brought was really, really wonderful. So I wanted to appreciate that and invite Helen now on as somebody who's working with women and girls, but particularly women to position them as sole proprietors and entrepreneurs to contribute to access to health and well-being products, but also being proprietors in their own right. So welcome, Helen. We are so thrilled to have you. And I wanted to pose to you from your thoughts, and especially after hearing Tiffany, Sonia, and Dr. Sultani also speak about the importance of interconnecting women leadership, but also thinking about terms of how do we broaden how we see empowerment and integrate women within healthcare service and healthcare delivery. I'd love to hear from you. What lessons have you learned from community-based enterprise models like FemVive that can help us inform national strategies? So welcome, Helen, and to you.
So thank you, Madiha, and I am happy to share the experience that I've gained talking to women on the ground. So FemVive began with a question, and the question was, what is it that women entrepreneurs need so that they can be able to conduct their businesses fully? And the voices were very clear, and they said they need a system. They need a system that works. They need the skills that are needed. So at FemVive, this is what we are going to do. We're going to equip the women with the skills that they need. We're going to train them on how to retain and how to attract their customers. We're going to give them the digital tools that are needed for them to thrive. So the first thing that we had to do was to answer that question of what women need to thrive. And that question, we, as FemVive, we're already going to answer that question. The other thing is that we have been able to speak with these women. And women are the caregivers, and everybody has said that. And unfortunately, care cannot be measured using any matrix. So I guess that is something that we all need to consider, that even as we're talking about care, we need to figure out how care can be measured and how care can be funded. So one of the fundamentals that we're doing with these women entrepreneurs, and the reason why I'm very excited about FemVive, is that these women are doing business within the communities. So they are talking to people who they already know. They are talking to their family members. They are talking to their friends within the communities. And people buy from people they like. So trust is one of the main components for businesses to thrive within the communities. The other thing that the women are telling us is that this needs to be scaled. And you can only scale a service if the community trusts you. So again, I will repeat the issue of trust, because this is what we have seen and this is what we have had. The other thing we have learned on the ground is that the women are actually very interested in taking care of themselves. They're interested in these wellness products because they must take care of themselves. They can only give from a cup that is full. If they're healthy themselves, they've taken care of themselves, then they can be able to take care of other people. And what is important is that can they make money to reduce the financial gap as they're taking care of the communities and as they're taking care of their family members. So within FemVive, it is a platform, and I call it a business enabling platform, where women are able to earn and learn. And we also creating leaders from this community. It is an enterprise that it's very multi-generational. We're starting from as young as 19 years and to as old as 50 years. And we're saying the reason why the multi-generational is very important is because each generation brings with it the strengths that we need. So when we talk about sustainability, that's also what we are building. Another important aspect, Madiha, is that when you have something good that's moving, I've noted that there are partners who want to join. And therefore, it is important that we have partners who want to come and fund either the training or the digital aspect of it. And I believe that in another couple of months, as soon as we launch the enterprise, that we'll be able to share real life experience on the ground in terms of numbers, in terms of homesteads that have been impacted positively, and we can be able to grow the enterprise. For me, again, in conclusion, for now, I will say that we really need to find metrics of measuring trust, because the reason why working within the community would ever work, it's because trust is the key number one component. And again, it's not the usual system that we can go and fund. So we need to figure out how is it that we can bring in the issue of trust within the community, and we can be able to put that on a scale, however that is going to be done. And we can say, is it possible that we can be able to empower these women because they are the people who on the ground. They give us feedback, they listen to the communities. Today, if you want to know what's happening in a certain community, the best people to ask would be the women who are already working within the communities. And I will stop there because I know we would have lots of questions, and I will be able to expound more about what it is we are doing and why we're very excited as Pathfinder for this social enterprise. Thank you.
Thank you so much, Helen, for that inspiring piece. And thank you so much for all the wonderful work that you're doing. I wanted to underscore something that you said, which really is just a one word, which is trust, the absolute importance of trust as we think about healthcare service delivery. And Dr. Sultani, you're still with us, and I just wanted to pivot to you a little bit because we have some questions that are directed towards you, sir. And Helen, I just wanted to appreciate before I move to Dr. Sultani, how you framed a lot of the thoughtful considerations that we have to make as we think about care work, and the economy. So thank you so much, Helen, and I will come to you if there are any questions. But Dr. Sultani, now that I have you back, we've got two questions in the chat for you. The first question asks, Kenya has transitioned community health workers from voluntary roles to compensated positions. What strategies have been key to ensuring this model is financially and operationally sustainable over the long term?
Thank you very much for that very important question. I want to actually give two key considerations when it comes to sustainability of these community health promoters program. Number one, Kenya is implementing a devolved system of government. And so we have the national level, which has defined functions. And then we also have the county governments, which have defined functions. So we have calculated an amount of about 5,000 shillings every month, which are paid to the community health promoters. And this is divided equally between the national government and the county government. So the national government contributes 2,500 shillings every month, and the counties contribute 2,500 shillings. So it is a spread out obligation. But more importantly, we have actually calculated this amount, and we have now been able to preposition it as the investment we are putting into primary healthcare. This is the investment that we are putting into disease prevention and health promotion. You remember I told you that we are now trying to pursue this anecdotal information that for every shilling we put in primary healthcare, then we will save 9 that will go into curative. So this is the investment that we are looking at, and we have provided for it in our national budget. So it is a running budget item as a critical investment for national development. Remember, our government has 5 pillars for economic development, and one of them is universal health coverage. So this is a very important economic investment for the country, for posterity. So in terms of sustainability, this is a very important budget item. Thank you, and back to you.
Thank you, Dr. Sultani. I think that also touches a bit on the question that just also came up is but maybe you might want to expand a little bit, is what is the strategy for influencing public policy and shifting how public funds are allocated to the care economy? I know that you've touched on a little bit on this already, but would you like to explain the strategy just a little bit more?
Yeah, so thank you very much, Mahida. One of the things that I would like to just say is that, of course, we have our annual budgeting cycle where we look at the various areas that we want to fund. Now, remember, this budgeting cycle is based on something that we call the medium-term evaluation framework, which happens, it is like a 5-year cycles that are covered within a medium, uh, evaluation framework. So, in the current government's agenda, that is the government in place is called the Kenya Kwanza government. We have a policy that is called the Bottom-Up Economic Transformation Agenda, BETA, BETA. Now, this Bottom-Up Economic Transformation Agenda, I just touched on it, as you have correctly said. It actually prioritizes universal health coverage as one of the 5 economic pillars for the country. So that one is a priority already. So now when we go into budgeting as sectors, because now this is a sector-wide thing, before we even take the draft to the National Treasury for rationalization and then to Parliament, because Parliament is the one that appropriates, this is already captured under the priority government projects. So you'll find that whereas some budget items might not enjoy as much priority as these particular priority budget items, the issues around universal health coverage given priority. Number one, we have 4 pillars. Number one for universal health coverage is human resources for health. And this is where our community health promoters are falling. Remember, these are people within the community who have access to the community and are given a stipend. This is where most of the care work will also be happening. And also in terms of capacity building, a lot of information that goes into effective care work will be coming from this workforce. Number 2, we have a pillar on healthcare financing. So we have 3 strategies in which we try to make sure that there are enough resources coming into that space to take care of the human resources and the other requirements. So maybe just very quickly, number 3 is about the health products and technologies, the medicines, the syringes, and other things that we need for treatment. And then number 4 is about health information systems and digitization. Now, these community health promoters who are providing a lot of the care work have been equipped with smartphones and other, there's a kit that has quite a number of gadgets, weighing scales, glucometers, BP machines, and so on. So as they are doing their day-to-day visits, then they are able to collect a lot of data that now comes into a central server, and that is the information that we are now using as a government to be able to make decisions, to be able to plan. So you can see it is a whole value chain that has become very central to the provision of universal health cover, and it is very well defined within the policy framework. And finally, we have actually, in record time, we were able to enact 4 laws that will now be able to drive this universal health coverage. So whatever we are talking about is already, packaged within a legal framework. So there are laws that are driving the Digital Health Authority. There are laws that are driving the social health insurance piece. There are laws that are driving primary health care. So it is something that is already grounded in very solid policy framework and legal framework, which is drawn from the Constitution. Thank you.
Thank you so much, Dr. Sultani, for that real deep insight. And I love the bottom-up economic transformative agenda, and I'm definitely going to be reading about it and coming to you possibly with more questions. But in the meantime, please do connect with Helen. I think there is a lot of synergy between what Helen was showcasing with FemVive and what you have just spoken about, and we'd love to explore that kind of potential collaboration. collaborations. But Sonia, may I invite you, as you heard from Dr. Sultani, there is a lot of policy framework, legal frameworks that are conscientiously being put in, as well as being supported by data and information. And I'd love to just quick reflections on your end. How do you maybe see these policies enabling women's entrepreneurship and care work?
Thanks. Yes. Yeah, I mean, I think I'd be more confident in speaking about Africa and maybe the global South, mostly because, yeah, I'm based in South Africa. And yeah, it's very exciting to hear the important work that's been done in Kenya. As we know that, women in the global South still operate largely in informal and underprotected environments. In fact, there's a paper that was written by Salima Valiani called the Care Economy Index, where she evaluates all the care economies in all the countries in Africa. I'll post a link to the paper. But the paper is very interesting in that it shows that Africa is still far behind in terms of incorporating strong policy frameworks and fair labor standards in care work. I know here in South Africa, there has been some movement. Just recently, we instituted a shared paternity leave system, which is hopeful. We also instituted minimum wages that regulates how much domestic workers get paid. But what we're seeing is that enforcement of these regulations still remains weak, and many workers still lack access to, things like maternity benefits and social security. On the continent, I think frameworks like the Maputo Protocol, which recognizes the need to value women's unpaid care and explicitly calls for policies to reduce and redistribute unpaid care, is important. But yeah, this commitment hasn't yet kind of translated into any comprehensive national care economy policy. I think, a lot of the work and thinking around policy and incorporating a care economy in policy has been done by the UN, and of course ILO's 5R framework is important. The recognize, reduce, redistribute, reward, and represent. The question I think that we should be grappling with is, how do we build a strong enough movement, an organized movement around our demands as carers. And in terms of kind of fair labor standards, yeah, I would agree that this is a legal question, but it's also, I think, a very economic question. So yes, we need to think about how do we integrate care into national labor regulations to incorporate social protection so that, informal work and part-time work is paid. But I think care infrastructure, as I mentioned earlier, is important. We need to think about how we finance care through national budgets. We need to move away from austerity to expansive fiscal and monetary policy that really thinks about carers and infrastructure that supports carers. And yeah, I think also data is very important. It's important that we have important gender disaggregated data. And so, yeah, feminist economists have been doing this for a long time. They've been looking at time use surveys and trying to understand where women's time is. I think investments in data and gender disaggregated data is important for us to kind of understand our demands towards kind of fair labor standards. Globally, just to mention that the CEDAW, I forgot the acronym, I'll put it down, but these are all important regulations, ILO convention. These are, SDGs, as contentious as they are. These are really important frameworks that we should be using to our advantage to push the needle forward in terms of ensuring fair labor standards for women. Thanks.
Thank you, Sonia. And thank you for giving us some food for thought and some really insightful pieces of work to reflect on. I'm mindful of the time. We have 5 minutes, but Tiffany, there's a question to you. And just quick reflections from your end. Do you find that the lack of clear policies and standards around care work is a major barrier to recognizing it as central to economic development?
Yes, I do think so. I really do think so. I saw that question earlier and I thought that it is an interesting take. Because as you know, we came to agree that if governments are not prioritizing women in the care sector, women who are doing unpaid care work, women who are looking for paid roles in health and social care, if they're not being prioritized in some way, being brought into economic policies and actually becoming, in a way, part of a country's national economic framework, then there is going to be a problem. This almost exploitative care work will continue to happen. Young people who are looking for work, who really aren't being able to find work and are having to fit into those roles, will continue to not really get, the rights they deserve in that way. So that I think that was a really good point to bring up. Yeah.
Thank you, Tiffany. And on behalf of us at Pathfinder International and the Women in Global Health, I just wanted to take a moment to appreciate the wonderful panelists that we have in front of us. If you could all just, for the last moment, turn on your cameras, give us a wave as we move towards wrapping this up. I deeply, deeply appreciate your contributions and your insight. And I would love to take this conversation further, maybe offline someday. But in this, for this hour today, I want to thank you and appreciate all the work that you've been doing, but also all the insight that you brought to us today. So thank you so much. And without further ado, handing it to the incredible Dr. Magda to close us off.
Thank you so much. Thank you. I want to join my voice to thank our fabulous panelists for a very insightful conversation. I also want to thank our keynote speaker, Dr. Sultani, for joining us and for the very good examples he has given us on what's going on in Kenya. So I think we all have good lessons to learn from what's going on around the continent. And it has been incredible to really organize this high-level side event with Pathfinder during the Second World Summit on Social Development. Just to insist on some of the points that were raised, I wanted to remind you, first of all, that as Women in Global Health, we have 65 chapters across 60 countries. And these are some of the issues our chapters have been struggling with, trying to bring the care work that women do at the center of health systems, trying to bring equity into global health by strengthening women's agency and leadership, and also by enhancing gender responsive health policies and laws and practices. Through our work and in collaboration with our partners, we have been contributing to growing evidence that shows that investments in women's health and leadership yield transformative results in advancing gender equality, reducing poverty, and also in driving inclusive economic growth. We also work to drive a new social contract for women health and care workers that includes fair pay, safe work, equal leadership, and recognition of the need to redistribute unpaid care and work. Beyond just being an inspiring dialogue, the panel showed that investing in women's leadership, including women-led, locally driven solutions, and the care economy delivers measurable gains for gender equity in global health. We know that investing in women's health is not only just the right thing to do, it's not just right, a human right, but it delivers a powerful gender dividend. Women's health is inextricably linked to economic productivity. We have increasing evidence about that. It's linked to prospects for prosperity and contribution to economic output. Um, there is a body of evidence that shows that if we address the 25% more time that women spend in poor health compared to men, not only that would improve the health and lives of millions of women, but could boost the global economy by at least 1 trillion annually by 2040. And 2040 is just maybe 15 years away. It's around the corner. We thought 2030 was far away, but we see that 2030 is around the corner. So 2040 is not far away, and that could boost 1 trillion US dollars annually. If you think about that, it's a lot of money that actually could be reinvested in building resilient health systems. We also know that the care economy is an untapped source of opportunities for job creation, for income generation, for social mobility, and more, amounting to the equivalent of nearly 2 billion people working full time for no pay. Unpaid care work represents 9% of global GDP. Think about that. That's equivalent to 11 trillion US dollars. So, just a way of closing, allow me to request that we commit, engage for a couple of opportunities that I see that if we work together, we could help move the needle a little bit further. I want to request that we collaborate with Women Global Health and Pathfinder and other like-minded partners in capturing commitments, evidence, and key messages from this Second World Summit on Social Development in this particular side event for investing in women's leadership in global health and the care economy as proven strategies for equitable social and economic development. I also wanted to request that we contribute to the co-production of a policy brief that strengthens advocacy for the care economy and identifies strategies to reduce and redistribute unpaid care while boosting women's labor force participation, income, and leadership in health. My third request is please partner with Women in Global Health to strengthen women's leadership and transform your institution's approach to gender equity in global health through our gender transformative leadership and intersectionality training. And then finally, consider using our Speakers Bureau to engage expert voices from our global network of women leaders in health. The Bureau connects partners with experienced advocates, practitioners, and researchers who can speak to the intersections of gender health and the care economy, bringing lived experience, evidence, and policy insight. So these are my 4 requests. We need to come closer, work better together, coordinate and collaborate. I want to encourage us to move from dialogue to action by investing boldly in women's health leadership and the care economy to build a healthier, more equitable world for all of us. And with these few words, I hope you have heard me well. I want to thank you again and then declare close this high-level side event. Thank you, everyone.
Thank you. Adiha, maybe we can
Thank
close
you.
it off. Thank you.
Yes. Thank you again, Dr. Magda. That was so insightful. And on behalf of Pathfinder, I'm committing to working with women in
Thank you.
global health as we partner together to transform.
Thank you. Thank you. I think 2025 has been a great year for the two of us, right? For the two organizations. So let's keep up the good work. Thank you for the partnership. We really appreciate it. Thank you.
Thank you, Dr. Magda.
Okay, bye-bye.
Bye, guys. Thank you.